This episode is brought to you by our sponsor, Artery Inc. You've probably heard me mention their vast collection of artistic, anatomy-inspired apparel, but I'd also like to highlight some of their other items, such as the Show Me Your Guts coloring book for adults, which is really cool. So I would encourage you to go check it out to see what exactly is in a coloring book for adults that has to do with anatomy. It's pretty amazing. Use the link in our show notes or go over to www.arteryinc.com, that's INK, and use code LISTEN2PHP at checkout to receive 10% off all orders over $35. You'll save some money and you'll show your appreciation for the show. Note that the discount, however, does not apply to subscription boxes. This podcast is for entertainment purposes only. It is not intended to provide medical advice. It exists, well, only to entertain. Hey there, podcast listener. Whether you're a new fan or a returning fan or just kind of randomly came across this show. Hey, I'm Dr. Max, and, well, I wasn't there for this recording. This was the one time I left the kids, so to speak, alone, and they had to record the episode on their own. So, with that, I want to say thank you to Aaron, Mike, and Elba for doing an overall very good job. I didn't want to point out that didn't record a disclaimer or, kind of missed parts of the ad, and the outro came way after the skit part, and they improvised the skit, so all of this is a little bit different than we normally do, but nevertheless, very much appreciate them covering while I was gone, and I certainly had my work cut out for me to put the skit together from what it is I was working with. I do love a good challenge. Let's go to the show. Oh, looks like Aaron didn't do a narration for the skit. That's okay, I heard it. I did the editing on it, a lot of editing on it, so I think the skit went on for somewhere in the neighborhood of 20 to 30 minutes and had 4 different accents and characters and, probably needed like one intermission. I condensed it a little bit. So, here it goes. In a hospital in the South, for some reason, 2 doctors working in the emergency department are handing off a patient case when they notice an unusual odor about the emergency room.
Oh, my goodness, it's a beautiful evening out there. How are you doing tonight, Mike? I'm coming in ready to take over. What you got for me tonight?
I'm doing fine, Aaron. I'm doing fine. I got a couple patients to side out. One, I was wondering if you could come in the room.
What you got? Okay. Yeah, Are you sure you don't want to just tell me you can get going? You get skedaddle off to your whatever you got going on.
You know that bedside handoff. People love that. I got this real nice lady. She seems real sick, and I smell this funny odor kind of building in the department.
I did notice that coming in, so I did notice it. Oh, Mike, I do declare, outside the room, it smells worse out here.
Oh,
it's almost, get a nurse over here. We can't take care of this. We're doctors. We don't clean this kind of stuff up. We need.
What's up, bros? Mike, Aaron, how's it going?
Oh, God, it's the traveler.
Man, you're not from here. I don't even know if you can take care of people down here in the South. Anyway, what'd you just say, bro?
I said, what's up, bros?
Oh, all right.
How's it chilling?
I'm feeling pretty tubular. Is that what you people say? I'm feeling, like I could hang 10 out my mouth right now. I just would just, oh my God.
Tubular, bro. What's up?
Oh, do you notice that smell around here? Oh, it's so bad.
Oh yeah, that's my halibut.
You're what?
Look around you. Everybody is laying on the ground.
Did you?
We got 30 people on the ground.
I just started baking a halibut in the microwave.
You can't. Oh my God. Did you use the one in the break room? You used the break room microwave. Is that what you did?
What other microwave is there, bro?
Everybody knows it's an unwritten rule. You don't reheat fish in an emergency department because this happens.
No, it's fermented. It's fine. It's fermented.
Like it fermented. You have had drink too. You got that kombucha, don't you? Oh my God. Did you? Is it kombucha fish?
I did. I fermented the fish in a kombucha. You're just being hysterical.
Now, listen here, men don't get hysterical. We just get ill with real things. We never overreact.
I don't know if you've noticed, but we are the only males here today, and we're the only 2 people left standing. All the other females are on the ground. They've all passed out. They're vomiting.
Now listen here, Tabitha from Malibu or whatever your name is. Please don't ever reheat the fish In the microwave again. Thank you very much. You know what? I need some bourbon because that'll settle the stomach. Okay.
That was something.
It was something.
Oh my
We
God,
made it
that's
up.
my phone.
We didn't have a script. We didn't write anything. We made up a whole thing. We did it.
All right, there you go, Max. That's your present. Just try to edit that.
Alba.
You gotta listen, you don't have to read.
Welcome, everyone. This is Poor Historians, a podcast delving into the archives of medical history. As three emergency physicians and one undaunted intern, we will explore the unusual ailments, treatments, physicians, and all related material having to do with the healing arts. I'm Aaron, and I'm joined here by my good friends and colleagues, Mike and Alba. How are you guys doing?
Good.
Yeah, same. Missing Max, though.
Yeah, I know. Max is away. I was going to make fun of him because he makes fun of me when I'm gone. So I thought it was only fair. But really what I realized is I think Max is our show mom. So like
Truly.
he does everything for us. I don't know if your guys' do your guys' moms still like send you care packages and check in on you and do more than you need them to? Because my mom does.
100%. My mom knits me sweaters and calls every day, makes sure I'm good, always checks in on me. Yeah.
Right? That's what moms do. And he's our show mom. Yeah.
His orange slices are the best.
So I noticed there are moms at work, and whenever they have the dads do the jobs for the kids, they're like, oh, I hope my husband can do this today, and we'll see whether he can do it without me. And then I talked to him, and they're like, well, I made him a list, and I wrote down the things he's supposed to do in order, and then I packed all the kids' lunches, and I color-coded them, and I pre-packed the bags, and hopefully he'll get it right. And I'm like, so Max kind of did that for us, so here's hoping that we can sort of be the show dads and not.
We're going to do great.
Yeah, we're going to do great.
I believe in us.
I think we can do
I
it.
took a whole 36 minutes preparing for today. And it's going to show.
Yeah. So we are recording this in late summer. Do you guys have, I'm thinking where we are, which everybody knows is Wisconsin anyway, right? Don't they know that by now?
Yeah, they know that.
Yeah. Like late August is always when people go up north. Do you guys, does late summer mean anything to you guys? Do you have tradition?
I
Not me.
don't.
Mm-mm.
You don't? You guys suck.
I normally it would be anxiety because of the start of this school year, but I think now it's just anxiety all the time.
My tradition is anxiety. That's perfect. I love it.
What do you do for fun? Anxiety.
Anxiety
Most
all
of
the
the time.
time.
Sometimes obsessing. Yeah.
Yeah, I'm in Chicago and it's still really hot down here too. It was like 100 today.
Yeah. It's called, isn't it a heat dome? I think is what they're calling it.
Heat dome. Is it like El Nino's step cousin?
Yeah. Everything's got to be called something now. It's not. It's
Tina
a heat
Turner
dome.
returns to the heat dome.
That's No,
That's
it's terrible
Thunderdome.
here also. Yeah,
the
it's the worst.
Thunderdome.
Yeah, no, everybody has cabins that I do not, but we often
No,
go
people
back.
from Chicago just come up to where we live. They're like,
Yeah,
oh, it's up north.
up north, which is Lake Geneva for them.
I saw, I think it was an Instagram video, and it was a bunch of guys from Chicago talking about what they do in the summer, like what Chicago is known for. And they're like, Wisconsin. They're like, no. What do you do here? Like, we go to Wisconsin.
Yeah. Yeah, I think I went up to Egg Harbor one year, but otherwise, no, just anxiety.
That's still kind of up north.
Fair enough. Yeah, it is. It's up north. So, Mike, you have a case for us to go through. Is that what I understand?
do. Yep. I thought long and hard, and I actually found the site where Max found the Edgar Allan Poe case. I'm a little irritated because it's all done already. No.
You found his Cliff's notes?
Yeah, I did. Yep.
Oh, Showmom has skills. That's part of it.
So they had a bunch of other ones. So I actually using my own Google search, found this case, and I don't know how interesting it is and whatever, but it's from near history. And I don't even know if it's history, and it's not somebody famous. Yeah, it's a case
It's not
that made
somebody
the paper.
famous, and it's not history, but yet we're on a medical history podcast.
It is history because it was in the 90s,
Okay.
which is one of the greatest decades ever.
Here, here. I agree.
Mm-hmm. So we're going to be practicing emergency medicine in an ER in California in February 1994.
Okay, so how have things changed? The CT scanner is not as fast,
but still accessible.
and we have fewer things that are video.
We have no video things. We probably have bronchoscopy, but it's probably direct.
Yeah, you're probably
What's
going
a
to ask that question.
what's a bronchoscopy?
So you can-
What's a direct or indirect bronchoscopy? Because I'm guessing it's lungs, right? Broncho, lungs. Okay, cool.
Yeah. And oscopy just means look at, right?
Yeah,
More or less.
look at. So
they
looking at your
probably
lungs.
they probably had these scopes where you could look in like a series of mirrors. You could see where you need to see. Now everything's digital. So they had those things.
Oh, so they would put like a tube down your windpipe to look in there.
Yeah. And it's either sometimes it'd be a direct eyepiece, like you would actually just look down the tube, like you're looking down a
mirrors. Okay.
spyglass.
Wow.
Yeah. That's no fun.
Up close and personal.
And now it's like digital, like cameras would do.
Yeah. So there's a big screen. So you have a flexible tube that has fiber optic, or I don't know, camera on the end of it.
Yeah.
Some wires.
Yeah, some wires.
Of
some kind. But yeah, you get a big old screen then. You have this big, beautiful screen. And the same with laryngoscopy, which is the same thing, but looking at the larynx where we place breathing tubes. So now it's a big screen as well. So, and that used to be just a blade. So from the 40s to the 90s, there was very little change. It was essentially this metal blade, right?
I could tell you in 2007 when I graduated residency, I probably
still was. We
were all doing direct.
Yeah, I was too.
So that's no camera.
Yeah, all the way up into the late 2000s.
Yep.
Just looking, and it's a you have to just look, and it's monocular, so you only use one eye. So you got to figure out like which eye you normally use.
What you do?
Which one's the good eye?
I just keep both my eyes open.
No, you can't. It's you didn't know this. We went to the same residency. They did this whole thing. They're like, it's only one eye, so you got to pick which is your good eye.
It's been 15 years since I've only done the video now since I've been out.
Yeah.
I don't remember looking with one eye.
We have one guy left. I don't even know if he's a fan of the show, but we have one guy left who's doing it the old way because he thinks he's better at it. And who knows? He might be, but who am I to say?
But there's probably no difference.
All right. Anyway.
All right. We digress. So we have technology available to us. So a 35-year-old patient comes into your ER. She's got a history of late-stage cervical cancer, under the care of an oncologist, receiving chemotherapy. She's been on chemo for a week, chemo radiation. The night in question, she gets altered at home. Was complaining before she got altered, complaining of chest pains. She had some vomiting and had breathing issues. So her fiance called 911. She comes in by ambulance.
Did you say altered at home?
Altered.
Yeah.
What
does that mean?
So like kind of confused.
Oh, okay.
So she was awake, but they said incoherent.
Gotcha.
Yeah. So altered, short for altered mental status, which is when we have a box like, and again, I said this to a patient last week and I realized the connotation of putting people in boxes, but like, so categories, we have a category of a diagnosis. We're like, okay, we have like a set of things we look for with altered mental status.
Gotcha.
And I don't know if we need to explain late stage. I mean, that just means this cancer is spread.
Yeah. Well, it sounded like, so the way the family described it anyway was that it was late stage, but treatable. And they said that they thought they were going to have a couple more years. And then this happens acutely.
Yeah, that's a whole other discussion, right? In the 90s, late stage probably still meant it was, not widely spread because otherwise they wouldn't have thought, okay, all right, so that's the patient.
Okay, yeah, so altered chest pain, shortness of breath. Can't really tell you a lot of information.
Okay.
What else do you want to know?
Well...
Or I guess what else are you... I guess historical things.
Any other historical things? I mean, so did this start all of a sudden?
Yep, suddenly that night.
Okay. And you said she's altered and she has chest pain and such. And she has trouble breathing?
Yep.
Does she have fever?
No fever.
No cowbell. Okay. All right. And when was her last treatment? So did she get chemotherapy the last couple days?
So she's on home chemo.
What?
So it's getting an infusion.
Oral? Oh, was she getting an infusion when she got sick?
It's hard to tell from the record because I'm looking at like newspaper articles. There's no great like medical documentation of it that I could find anyway.
So this is one of those patients that, what time of day is it?
8:15 p.m.
So I think ER doctors are, all of a sudden we become the best oncologists in the world after hours. We also become the best ENT docs, the best surgeons. Because after the office closes, they're all like, just go to the ER. And I don't mean that to be mean, and actually our oncology colleagues call us back all the time, and they usually know their patients really well. Okay, so like we can talk about how she looks initially, but you have a cancer patient who suddenly got short of breath. So with cancer, the obvious one that I struggle to find the other ones after is a blood clot in the lungs somewhere. So cancer always makes you more likely to have a blood clot in the lungs. So that's number one.
So that's your initial worry. That's like all of us are going to think that it's a PE.
Yeah. And then cancer will also make you accumulate fluid. So you can get fluid outside the lung, but inside your chest. You can get it around the heart. So the heart has, hopefully we've talked about, I think with the aorta, we talked about this before. The heart has like a sac around it. It's got like a little covering. And normally there's just a tiny, tiny bit of fluid in there, which is like a lubricant. So the heart will be inside it and you don't notice anything, but you can get fluid and inflammation and blood inside that sac, but outside the heart, and the sac doesn't stretch. So then it will slowly compress the heart, and then you can't maintain a blood pressure if you get that. So I think about those things too.
That's called the heart scrotum.
Yeah, that's right. Sac, because I said sac. Yeah.
I was going to ask, is that similar with CHF, with congestive heart failure, when they say like fluid around the heart? Is that what they're talking about, like around that in the sac?
Yeah, unfortunately, not in any way at all. Like it's completely different. No, that's great. Okay. No, it's great. People say all the time, they're like, I was told I have fluid around my heart, and we use that not infrequently. But with heart failure, the heart, if you think of the heart as a pump, it's not pumping forward. And when it can't pump the blood forward because you're having heart failure and the pump's not working, the backup goes into the tissue of the lungs. So it actually will accumulate fluid inside the air sacs, inside the lung tissue itself. So
potentially around it.
Well, potentially around it, but it can do both, right? But it is a little bit different. You don't usually get in trouble in heart failure because the fluid around the heart inside the ball sack of the heart is compressing the heart. It's because it's like it's in the lungs, so you can't breathe well. So it's a little bit different. But Mike's right. You can also accumulate it the other places too. So, that's why we explain it the way we do, because it gets really confusing.
Yeah.
We don't always know. We don't always know exactly where it is everywhere, Yeah.
So we're setting up differentials. We got PE is probably number one.
Yeah. So then classic board style. If I walk into the room, what do I see, smell, and hear?
Yeah. There we go.
Oh, that's
smells. You and your smells, Aaron.
All right. So she is awake but incoherent. So, can't appropriately answer questions, but the fiance is there to answer anything that you might need to know about what he knows.
Fiance? How long has she been sick? That guy's a hero. Can we sidebar a minute?
Yeah. I don't know. I mean, she's 31.
Yeah,
maybe
but
it's a really long engagement.
That's great. Good for... Well, why didn't they? So I want to know that whole story. I think we should just sit and talk about their
relationship.
Yeah. We'll talk a little bit about
romantic, tragic relationship, because, I don't know. I want to know whether I should be mad at the guy that they haven't gotten married yet, or whether it's awesome that he still wanted. Oh, and if they're fiance now, see, now the other part of my brain is kicking in. I'm like, I'm wondering why is she all of a sudden so sick? But they're not married yet, so he wouldn't get, if he somehow poisoned her, then he wouldn't get inheritance. So that's not it.
Yeah,
is she an heiress? Okay,
it's not a romance mystery novel. Okay,
you don't know. It might be. It might be.
Maybe.
And hopefully, there's ominous music going in the back, Max.
Exactly.
All right. So chest pain, shortness of breath. We're thinking PE. We're thinking fluid issues. You walk in. She's awake, incoherent. Does that make you think of like brain issues, like maybe Mets to the brain?
Yeah. So the incoherence, you can get incoherent either because you're sick. So you can get incoherent just because you're sick. So low oxygen will do it. If you have a really bad overwhelming infection, that'll do it. Low blood sugar, that'll do it. But then you also can get incoherent because of stuff going on in your brain. And if she has, late stage cervical cancer, if she has, I don't remember off the top of my head if cervical cancer goes to the brain. I don't think it's that frequent from there.
I honestly can't remember either.
I know breast does, no lung does, but I don't know if cervical cancer does. But you would always kind of consider it like, does she have a cancer in the brain or around the brain? That could do it too.
Yeah.
And then, the chemotherapy could have done something too. So.
Yep. So you're going to do your ABCs, your airway, breathing, circulation. So her airway's intact. Her breathing is unusual. They're describing Shane Stokes respiration. So a breathing pattern that goes shallow to deeper to shallow to deeper. And unusual, usually related to about 100 different things. So you can't rule anything in. You just know that this person's sick when they breathe that way.
Well, but often it's neurologic, right? I mean,
it can be.
No, you don't know. Okay.
Yeah. So and she's tachypnic. So her respiratory rate's really fast.
Like how fast?
40. Don't know. Let's just say
30.
40. 36.
That's really fast. That's so fast. That's way too fast.
Breathing really fast with Shane Stokes variations. And then she's tachycardic. Didn't see any documentation, but let's say it's 180. This is your initial exam.
180? That's way too fast.
Yeah. Let's just say that's what it is. Yeah.
That's super fast.
So, and you meet this person right away when they get in. You identify that they're sick. Sick.
I do.
Mm-hmm.
All right, I run into the room.
So 8:15, 8:20.
Oh no.
What happens?
I don't know. Something bad.
She arrests.
Come on.
Because you were taking too long. You're talking to her fiance about
I was not. That's not what I would do.
Interpersonal things, and your back was turned to the patient. She codes. She goes into VFib.
Codes. Okay, you're saying a lot of words. Are we going to have to stop and
ventricular fibrillation? Yeah, so that's a fatal heart rhythm. And I don't know that that's what it was. It was either ventricular tachycardia.
Well,
which
you
is
said
really
she
fast.
codes.
She codes. So
does that make sense?
Code is like a cardiac arrest.
I know codes because I've heard the word thrown around, but cardiac arrest is what I think of. Like, it ain't good.
Yeah, no, it's
the
not
heart's
good.
not doing what it needs to do. You're in big time trouble.
If we were in Grey's Anatomy, they would overhead. And
that's when they run,
code blue,
right?
and they all run. They run super fast, and somebody starts CPR.
And they used to do code blue, and then they changed it to code 4, and now it's medical emergency.
Medical emergency. That's us. Yeah. That's what we do. Yeah. Okay. Gotcha. Well, I mean, things get very simple when people code. First off, this sucks.
Yeah.
So the overall survival rate of people that have cancer who code is, 1% or less. I mean, as soon as it gets that bad and somebody has cancer that's spread, their survival's dismal. So that's all very bad.
So now you start to think about maybe other things, right? So they arrest. So we're looking at like, what are the reversible causes for that cardiac arrest or that code? Yeah. So then you start to think like metabolic issues. You think potassium, right? So potassium's pretty high on the list. High potassium could do this.
Yeah. I mean, okay. So.
But she had chest pain and then she codes after having chest pain.
Yeah.
And her EKG does not show a heart attack.
Well, that's fast. Convenient. Yeah, you just added that after the fact.
So we ruled that out, right?
Well, we don't. Theoretically, not a heart attack. All right, so somebody starts CPR. Mm-hmm. Did somebody start IVs while I was talking to the fiance about his long lost love? Working on. So, that's bogus.
So the nurse gets an IV.
Working on.
Yep. Okay. So they draw blood. What would you like to order?
I don't care. Yeah. I don't care what's in the blood right now. So yeah, CPR, and then we got to do
except for the potassium. You want that?
Well, yeah, you do the normal stuff that you would do. So there's a list of metabolic things that Mike kind of went over. Yeah, high potassium, low blood sugar.
What is it about metabolic things that could lead us to this point? Is it the coding that could lead to the coding part, or to all of it?
Yeah.
Yep. So there's certain metabolic things that could stop your heart, essentially. So low blood sugar eventually will do it. So usually you get confused first, and you get all sweaty, and then you would have a seizure, and then your heart would potentially stop if your blood sugar was low enough for long enough. Then really high potassium can do it. I suppose theoretically really low potassium can do it too, but really high potassium can do it. And then if your body is really, really acidic, it'll do that. So those metabolic things. So I would, we can send off tests now. In the 90s, I don't know if they had point of care testing, but
no point of cares.
Yeah. So you could try to send those tests, but really you kind of fix them all. So back then, before they might have had 90s glucose test strips like right away, but usually sometimes in a code you would just give the things. So you would give sugar, you would give sodium bicarbonate, which you can use to reverse the acidosis, and you would give a bunch of stuff for the potassium. And then there's another list of things related to the chest pain. So a blood clot can cause your heart to stop. A heart attack can cause your heart to stop. Increased pressure on one side of the chest from a collapsed lung can cause your heart to stop. Fluid around the heart can cause your heart to stop. A rupture of the blood vessel in the chest can cause your heart to stop. That's probably it that I can think of. Heart attack.
That's a lot of things. That's a lot. That's plenty.
Yeah. So you think about things you can fix. So, I mean, as soon as people start to code, you start CPR, and then somebody starts to breathe for them at about 10 a minute. So you have somebody like providing oxygen. So you can listen to the lungs on both sides. Did we have ultrasound in the 90s?
I think we might. Yeah, I'm sure we did, but I don't know if we had a bedside. I forgot to mention that before she arrested, you decided to treat her symptoms. So you gave her IV fluids, you put her on high flow oxygen, so non-rebreather, and you gave her Valium, Versed, and Ativan.
Why the hell did I do that? I'm a terrible doctor. I would never do that.
Yeah.
That's awful.
And this is what they listed all three. So
that's so bad. Valium, Versed, and what was the other one?
Ativan. So all sedatives. Yeah.
What? Why would they do that?
Treating anxiety.
Okay. So let's back up a minute. Yeah. Okay. So let's talk about that. That's oof. Wow. Okay.
So
was this a malpractice case?
I believe there was, but not for the reasons that you think. We'll talk about that.
Okay. So all of those
became unstable, requiring CPR ultimately within the first 15 minutes of being there.
Okay. Well, so let's back up a minute. So you said Ativan, Valium, and Versed. Mm-hmm. So those are all benzodiazepines, which if you're a follower of like TMZ and such, like that's Heath Ledger he's the famous one that he had like 3 benzodiazepine prescriptions, and then he got pneumonia, and then he died of overdose versus being too sleepy.
Just sedate. Yeah.
Yeah. So they're all sedatives, and they all act on the same part of the brain. And they all cause low blood pressure, decreased breathing, and, sedation. Like you get stoned, you get really high if you take all of those all at once.
And I will say, I don't know, again, not a medical description. There was very limited information. So these were all listed. There's tons of
That's crazy. And Versed is one, that one acts within like a minute. That one's like super quick.
I mean, that would be the one you would give, right? You give Versed.
If you're going to give it.
If you're going to give it. But you're not going to give it here. Yeah,
no,
you're not going to give it.
No,
but
why?
Maybe in the 90s it was different.
Why? Because, so this is where like people think we're mean, and because they're like, I can't breathe and help me. And we're like, well, okay, but I got to figure out why, because if I just try to make your symptoms better, but your body's doing something to try to save itself, I have to understand that before I just make you feel better.
Right.
Because you could make that person feel less hungry for air or have less pain, but if you don't understand
but then they're
what
less
the
hungry
shock
for
is
life.
coming from.
Yeah.
Right. Right. So like you could give those medicines now, depending on what your preference is, if you had already handled the breathing, like, okay, I'm already going to try to treat the underlying shock or
maybe
whatever.
They're going to intubate. Yeah. They're like, we'll make her comfortable until we intubate.
The Versed could have been to try to put a breathing tube in. Yeah. So if was she low, you never gave me her vital signs.
So we don't, heart rate 180. Blood
you said 180. What is her pulse ox?
Pulse ox it's 98% on non-rebreathers. So that's 15 liters per minute.
So she's got a really fast heart rate, really fast breathing rate, and then a normal oxygen. So, I suppose you could see you're trying to make her feel better. You could try those medicines, but I would not do that because I'm afraid they're going to, die. Okay.
So you mentioned collapsed lung. They did a chest x-ray. That looked fine.
Okay.
No pneumothorax. Lungs look good.
Okay. Yeah.
And that would rule out the pulmonary embolism too, the blood clot. Oh, with the chest x-ray doesn't rule that out?
No, you'd need to do a chest CT.
Okay.
Or a V. I don't know if they probably did angiograms of the chest. Otherwise, a thing called a VQ scan.
Yeah. So then, Mike's pointed out, so there's no collapsed lung. He says there's no heart attack. So blood clot's still on the table. That's not ruled out. Fluid around the heart is still on the table. That's not ruled out either. And then the metabolic stuff, let's say we treat that, right? We just give a bunch of stuff.
And you said you wanted blood, right?
Yeah, sure.
Let's nurses
do the normal. I got to yell stat, right? It's the 90s. I got to yell stat. Give me a CDC CMP type and screen and 4 unit stat.
Yep. IV goes in. Your most experienced nurse grabs the blood and pulls it out of the body and smells it.
What?
And
she smells
Here we go.
Yeah.
Here comes the smells.
And it
smells. What does it smell like? What does it smell like?
It smells strongly of ammonia.
What?
And she hands it off to the resident who's standing behind her in the code because she's feeling lightheaded. She drops to the ground. Unconscious.
The nurse does?
The nurse does.
The nurse passes out.
Passes out.
Smells like ammonia.
Immediately after smelling the blood.
Oh, dang it. Now I'm going to, I half remember this case. But not all of it. So I'm going to fail. I'm going to get it wrong. And everybody's going to make fun of me on the podcast.
So she hands it to the third-year resident who then smells
Passes
it.
out? Passes out?
She noticed that the blood looked unusual. She said that there was like manila-colored crystalline things in the blood. She smells it, starts to feel nauseous and faint, goes to sit down at the nurse's station, passes out.
This is not good.
The respiratory therapist in the room passes out. So now 3 people have dropped during the code. They're still coding this lady.
Okay, so I run from the room screaming and retire from emergency medicine.
So they evacuate the emergency department.
I just leave.
The whole emergency department.
Mm-hmm. And they're still coding her, right? So that's 8:15 she comes in. They evacuate. They left a skeleton crew in place to manage the code. And I don't know who they left. There was probably a physician, a nurse, maybe a respiratory therapist. Everybody else leaves. And I know they left the room. It sounds like they evacuated the department. I don't know if they did it right then. Unfortunately, this lady dies at 8:50 p.m., so 45 minutes after arrival, which is like reasonable for someone who's kind of like just about to arrest when they come in. You know, usually takes about that amount of time, depending. Yeah. They had some other issues. All in all, 23 out of 37 people that were in the room caring for this patient became ill. 5 were hospitalized, 1 in the intensive care unit. She was in the hospital anywhere, they said, between 10 and 14 days in the ICU. That's the resident. So that's the second person that smelled the blood.
What happened to the first person?
The first person was admitted but discharged, I think. Because again, only 5 were hospitalized.
Okay.
But the resident developed hepatitis and avascular necrosis of both knees after smelling the blood.
Okay. Well, I'm going to let my brain chew on that for a minute. Avascular necrosis. You probably want to talk about that. Those are big words.
Yeah.
Oh,
what?
Man. Well, it's just, your joints go bad.
I'm like, what? This is so scary.
Yeah. So the bones die because the blood vessels into the bones are impacted in some way. So avascular just means no blood flow, and necrosis just means dead. And usually it happens to bones.
Okay.
And you did, Aaron, you had asked about what you smell. Sorry. What you smell in the room, I kind of purposefully glossed over it. So the blood smelled like ammonia.
Yeah.
The patient smelled fruity or garlic-like.
Okay.
And the only other thing that they said was that there was an oily sheen to her skin.
Okay. All right. So, okay.
And I just want to make sure somebody that smelled this woman's blood ended up with their avascular necrosis and... What was the other thing you said? Hepatitis? Somebody got hepatitis from smelling this woman's blood?
Yes. Nobody got time for that. That was bronchitis.
This is insane.
Nobody got time for that. So there's a lot to talk about. Oh, this is a great case. And I wish I remembered when you had talked about it before. Darn it. Because then I would know the answer. But so from an ER standpoint, in general, when you think about toxicology, so you think about the sarin nerve gas cases and so on and all these things, this is why if you have an exposure of some sort, decontamination of the patient comes before anything else. Because if it's something that can be transmitted by touch or you can inhale it or anything like that, then it's going to take out your entire treatment team before you can do anything. And we wouldn't have expected it with this lady. I mean, you come in and you're like, oh, I have cancer, now I'm short of breath. You never would have expected, oh, you got poisoned or there's something to worry about. But yeah, that is part of that training, which is you have to sort of decontaminate somebody first and then you take care of them. And gas attacks, I think, are the main one, right? So that's, we're trained to do that, but we usually forget. And like when somebody gets sick and they could, like if this lady had come in from triage, I mean, even in the middle of COVID, there were, and we were told to do all these things, especially with codes. With COVID, they told us, they're like, you have to have everything on. You have to have all your people, like put on your personal protective equipment before you start the code. That didn't happen. Like nurses would they'd just be like grabbing people out of the wheelchair, maybe a mask, and just throwing them on the bed and like starting CPR. Like they didn't put stuff on. There's no way.
Have you seen that meme where it's like, it's like bed bugs and then the person's running away and then COVID or whatever, or even if Ebola and it's a picture of Ryan Gosling with his shirt off, like they don't care about that.
How nurses enter a room for a patient with COVID would be the Ryan Gosling meme. And then, bed bugs were like head to toe covered in a hazmat suit. But so we wouldn't, I mean, that's the thing. And this is true with a lot of, that was when we had an Ebola scare years ago, we're like, it would just like by the time we figured it out, it probably would be too late. So that makes perfect sense.
That's
that people would get sick.
Yeah, as ER docs and nurses, we realize like when our times come, our times come.
Oh, God.
Their fate is our fate.
So that's one part of it.
Interestingly enough, none of the ambulance crew was sick.
Okay.
I don't know if that makes a difference.
So, all right. So she has a sheen and she has an odor. Garlic makes me think of, cyanide is almonds. What's garlic?
Arsenic.
Other than really yummy arsenic. Okay. So we just talked about, I just did a damn case last week.
That's why I was doing this. I was like, I don't even know if we should.
Okay. All right. So arsenic, we got to put on the list.
Okay. Do you want to know the autopsy right away?
No.
Okay.
No. So I go back to the fiance. He could have poisoned her.
He didn't.
Okay. Ammonia. I mean, you can get circulating ammonia in the blood at really high levels because your metabolism gets all jacked. So probably she's got ammonia in the blood because her metabolism is completely halted at some point.
Yeah. Ketosis gives you an ammonia smell. I don't know about the blood, but I know your body can smell like it.
So ketosis, we should probably talk about that too.
Just like,
when your metabolism is down now. What now?
Yeah. So you don't have enough sugar to metabolize. So you start breaking down fatty acids and you get ketones. So that could give you fruity smelling breath and ammonia-ish smelling sweat. So
somewhere her cells are jacked, right? So you have all your cells make their own energy to some extent. And they all have these little pathways that they do it with. And they use, I can't even really get back in the weeds because it's all biochem and stuff that I haven't need to think about for a long time. But so when those ways that they make energy get all messed up, then it backs up and you get less energy out. So let me back up a second. You have these ways that work when you're doing things the way you're supposed to, and then you have backup systems that are much less efficient and use different products. So that fatty acid, that's what Mike was talking about.
The ketones
I can't access my sugar to make the oxygen I need, so I'm going to use my backup, which is like some janky, crappy set of cells that's only going to make a lower amount of energy, and it's a lot dirtier. So you make a bunch more stuff that circulates and makes you sick. So you make your body very acidic. So you don't want
ketosis.
No, right? That ketosis is you're on a backup power supply and you're using that, and the waste product of that, the exhaust of that system within your cells makes you really, really acidic. So you get sick because of that. And then you're simultaneously, that's the thing that happens with diabetics. You can't use the sugar that you need and you're on backup power. So you feel like junk. And then the circulating sugar makes you pee. And then it's a whole cycle. So this lady is on her backup power supply. Her cells are not happy at all. So then that ammonia,
unless there's something else.
Yeah. So that's one possibility, is her cells are so messed up that they're blocked somewhere, and one of those cycles isn't working. Like the urea cycle would be this, and you'd make a bunch of ammonia. Then ammonia makes you all confused, which would be the altered mental status. So
let me stop you.
I don't know if you smell ammonia when you have high ammonia in the blood, though. That's like a blood test.
I don't know that you do. I mean, see, the thing
I don't smell people's blood when it's in the tube.
Well,
I smell a lot of things.
Now we
That's the
draw,
one. That's where you draw the
lot of
line.
things.
Not when it's in the tube.
we
I
draw
smell their
blood.
feet. I smell their poo,
Yeah.
but I do not smell their blood.
God.
But they draw blood in vacutainers now. I don't know what they did back then. Maybe they did.
Yeah, it's true.
Maybe they're
They might
drawing
have
in a
just,
syringe. So
bloop,
like
bloop, bloop, bloop.
as it is now, I don't think you even could smell anything.
Swirl it.
You could
It's
take the
contained.
tubes off. You could take the tops off the vacuumers if you really wanted to, but it'd be messy and gross.
I don't know why
Nobody
they would do that. Yeah.
And it doesn't explain the sheen. Well, okay, so you could get kidney failure
sheen.
that caused like a frost on your skin.
Yeah.
The chemo. So if it's chemotherapy, you have to wear special gloves with a lot of chemotherapy agents because it'll come out the patient's skin and you can absorb it through touch. So a lot
Let
of
me just
chemotherapy drugs
say-
do that.
I'm going to tell you the autopsy.
Okay. All right. We'll go to the autopsy now. I've
The autopsy
failed
is
long enough.
kidney failure related to cancer.
Kidney failure related to cancer?
This was an autopsy done about 2 weeks later because they had to keep this person away from any
Everybody.
people. Yes, they had to do the autopsy with like hazmat suits on because they weren't sure what else was going on.
Yeah.
And the case is not related to that person. The case is related to the 23 other people.
Okay.
So what do you think happened to them?
All right. So you had one person who got super sick and ended up in the ICU with renal failure and
No,
avascular
hepatitis.
necrosis, hepatitis,
Titus.
and
Again,
avascular necrosis.
I want
So
to
that
reiterate,
patient's-
none of these are medical journals that I'm reading. These
That
are
person
all-
is actually sick. So
Yeah.
one thing at least happened, but 23 other people
Mm.
maybe not.
Yeah,
So
one
this-
sick ICU, 4 admitted to the hospital, discharged, on
After they
varying
felt
time
better.
courses. Yeah,
And 23 other people that were sick.
23 total that felt
23
ill but didn't
total.
get admitted.
Oh,
And
so
something so bad happened, a legal case resulted from it.
That we'll get into that later.
Okay.
Well, okay. So
And
when
their
you
symptoms
say,
were nausea, vomiting, passing out, lightheadedness, dizziness.
did they actually throw up?
Some did, yeah.
Okay, like a lot, or just like a small amount, like
Like
an amount
a
that
medium
could-
amount, yeah.
medium amount.
Like
So
little
yeah,
herbs.
and were there people outside the room that got sick?
They were people outside the room that got sick.
That doesn't make any sense. And then
Right.
there was a skeleton crew that still could run the code.
Mm-hmm. I don't
So,
know.
But they were in hazmat, the skeleton crew.
no. Hmm.
And nobody in the ambulance was sick.
Nobody in the ambulance got sick.
So that doesn't make
What
sense.
do
Because
you-
if it's
what are
a
you
biological
thinking, Aaron?
agent or whatnot, then what's this? Is mass hysteria? Perhaps. What's the new word for it? Not mass hysteria is the old pejorative
Mass
way to say
psychogenic
it.
illness. And the fact
There
that
you
I
go.
know
Mass
that
psychogenic
maybe means you're
illness.
onto something.
Oh, mass psychogenic illness.
There were 2 prevailing theories. The hospital had one. And then after the fact, people have looked at this case and all thought it's probably mass psychogenic illness. You're not going to like this, specifically Alba, because they said more women than men were affected.
No.
And they're prone to hysteria. Yeah.
No,
Yeah.
come on, y'all.
Yeah.
It's
And
their
if you-
wandering uterus.
If
The
you,
uterus
look,
just goes all over the body and
Yes.
causes trouble.
if you look at
No.
the symptoms, usually it's lightheadedness, nausea, vomiting. Yeah. So they had a lot of the prevailing symptoms. It doesn't explain
Alright.
hepatitis and avascular necrosis, right?
No.
Could those have been complications from an ICU stay? Maybe.
Avascular necrosis of the knees. That would be really
Yeah,
unusual.
I mean, it would
Did he
be
like
unusual.
fall? Was this the med student?
Yeah. By reports, she never actually fell. Like she
Oh.
sat down and then passed out.
Well, she's a med student though. We know they're weak.
No, resident. 3rd-year resident. She's as grizzled as you
Oh.
can get.
3rd-year resident. They actually have superpowers. They can
Yeah.
stay up for 146 hours straight
Mhm.
and
She's
run
been
through brick
shot
walls
30 times. Yeah, she showed up to work every shift.
every shift. Rebandaging herself. Okay, no, 3rd-year
Okay.
resident shouldn't.
Going back to the oily sheen, the thought was now, and I don't know that they actually tested for this, but they thought that the lady was covered in dimethyl sulfoxide, so DMSO. We've talked about DMSO before as an agent for like drug delivery systems. So it's an organophosphate.
Oh,
And what kind of symptoms are you going to get with organophosphate
The killer
poisoning.
bees. So that'd be the opposite of what she had, though.
Oh, wait.
Bradycardia, bronchoria.
Yeah, you're right.
It doesn't.
Yeah, I was thinking like anticholinergic, but this is cholinergic. She'd be like,
We're
Y'all, I'm
gonna,
sorry to
we're gonna have to talk
disappoint
about
you.
this.
There are a lot of words I didn't understand.
Yeah, she's like, wait. Okay.
Go back to the sheen. So she's got something on her body, and you said
Yep.
DM something?
DMSO, yeah, dimethyl sulfoxide. So it's an industrial chemical. But in the 60s and 70s, they were using or trialing it for a bunch of different treatments. They were looking at its anti-inflammatory properties. They were looking at its its use in cancer treatments.
Okay.
Oh, maybe she's doing it on her own.
By the 90s, they had
late
already debunked
stage.
this. Yeah. So it's a potent solvent. It's a degreaser, so still used industrially. And people will perceive a garlic taste after it makes contact with their skin. So there's a chance that they didn't smell garlic, but they actually taste it if they touch her.
Yeah.
So she was covered in this?
She was covered in it.
Like I wonder. So that could have been. That could have been something they were doing on their own.
Yeah. So it's used. Yep. Anti-inflammatory and a topical analgesic. So she might have had pain. They were treating her pain.
Or like some person said, this will cure your cancer, and she's like slathering herself in it. People do that.
Yeah. So that was my thought when I read this. I was like, she's looking at. I want a treatment. She's young. Like really bad diagnosis.
I just did a quick. Okay, I'm on Wikipedia now. So it says in the 80s it was marketed as a cancer cure.
Right. And then the FDA said that that was false and it was a fake treatment, fake promise.
And it interfered. Well, maybe it interfered with some of the cancer, some of the chemotherapies. So it might have done something weird with that.
It might have made it worse. Yeah.
Yeah. So then when he's talking about cholinergic and anticholinergic, like in your central nervous, oh God, there's going to be so many neurologists that come after me with this. So, because I just remember kind of what happens. So you have.
Say it really fast and go.
I won't know the difference.
Yeah. So, I mean, your nervous, there's all sorts of different groups of nerve cells, and the cholinergic, anticholinergic does a bunch of stuff in your body to regulate things. But
bravo,
if you're poisoned with a pesticide, you get really drooly and your heart slows down. What else? And then you get
pupils.
Water in your lungs, and your pupils get really big, and you get really sweaty, and then you eventually have seizures. And then on the other side of it, you can block those same nerves and you get the opposite. So like the classic one is a bunch of teenagers got into some Jimson weed on the edge of the highway, which is I guess a hallucinogen, or a lot of Benadryl will do this too. And then you have the opposite. Your skin gets really dry. Your heart gets really fast. That's your pupils get big. Your pupils get small when you have,
you're right.
You're wet. And then your heart, and then you get very confused and mumbly and stuff. So like you sort of have these things where that part of your nervous system can get activated or deactivated. And then you have these things that show up. And sure enough, I didn't think of it in this lady. And I also didn't think of it in my practice oral boards. And they're like,
did you get an organophosphate?
I got crushed.
Case?
Yeah.
Did you?
And they didn't.
What?
Yes, I did. They're like, this lady shows up and she's really gurgly and her heart rate's slow, and I'm supposed to figure it all out from that. They're like, well, it was a schizophrenic who drank a bunch of pesticide. I'm like, how am I supposed to know that?
They wanted you to fail.
Yeah, they wanted me to fail. But anyway, so the stuff she put on her skin could have poisoned her that way, and then that would be transmitted by touch or smelt.
Yep. So they would have tasted garlic if she was covered in this, because we don't know for sure.
Yeah, because they like inhale it, you probably would.
It's odorless.
Oh.
So they would have tasted it.
So they would have had to touch her and then put their fingers in their mouth? How would they taste it? That's
if
gross.
you touch it with your fingers, you taste it. So DMSO is...
What?
So yeah, they use it in drug delivery systems.
That's
so they'll
crazy.
put a drug in DMSO, you touch it, the drug goes in your body.
Whoa.
Yeah, so I don't know, like a fentanyl
it just
patch.
absorbs through your skin really easily.
Yep, and it's a solvent, so it'll take whatever organic thing that you have and will bring it into your body.
Well,
But so it's also metabolized to this thing called dimethyl sulfide, and that stinks like cabbage. Apparently, it's highly disagreeable. It reeks. But it's also used as a food additive. It stinks.
Why?
Yeah. And if you've ever cooked asparagus, cabbage, corn, or any seafood, you've made dimethyl sulfide. And it's actually also the smell that pigs that hunt truffles smell. They smell dimethyl sulfide.
That's crazy.
That's how they find the truffles. So I think that was the smell.
Yeah.
She had so much of it on her that she metabolized DMSO to dimethyl sulfide.
Huh. And then and then everybody, the people that actually got sick because of that.
Yeah.
That makes sense.
Well, no.
And then they saw
no, because it still wasn't.
No,
that's
they
not,
were hysterical. Is why they got sick, right?
Yeah,
Well,
all the women were hysterical.
This is potential
The resident was a
culprit,
woman.
too.
That's why she collapsed.
Yeah. So the first culprit
Terrible.
is mass psychogenic illness. Second is potentially DMSO, but DMSO is also metabolized to dimethyl sulfone. Sulfone. And that's safe. It's actually, FDA said you could use that. It had been used for treatment of HDL,
which is high
good
cholesterol. Yeah.
Or low.
Well, you don't want
cholesterol.
to treat. Why would you treat the good cholesterol?
Like you want it to go
the
up.
good.
I don't know.
Okay, fair enough.
It was a brief thing. I found it, and then when I was looking back, it was really hard to find. So then maybe I just thought I made it up. But it's also it's also metabolized in the presence of oxygen, dimethyl sulfate. And dimethyl sulfate is highly toxic. And it was like a contender for a biological weapon at some point.
So oh my gosh.
The second theory is that she was covered in DMSO. They had her on high flow oxygen. This oxygenated the dimethyl sulfide to dimethyl sulfate, creating a toxic gas that got people sick.
Oh, crazy. But then why didn't everybody get sick? I mean, okay.
So that's why it's still a mystery.
Some people have a stronger constitution.
Maybe, yeah.
Yep, that's right. Yeah.
So, so I thought that was just really interesting. It was like they were trying to
have done this. Like, I wonder. So, how does it get metabolized? Like, so the DMSO she put all over her skin, and then her body probably metabolized it, and then made it into the toxic stuff.
Because she would have ingested it. The question that they have is, how can the sulfide turn into the sulfate? And, they'll say that there's 2 oxygen difference between sulfate and sulfide. And that's probably why, but organic chemistry wise, it doesn't make sense that you could do that.
Oh man, I mean, I even liked organic chemistry, and that's so far
I didn't
back.
look into the details.
Idea.
They're just,
you didn't do the reactions? Trash.
No, there's a couple chemists.
You should have made the little things. You made the little models.
I guess I could have solved it.
Pulled off the oxygen. Well, that is not what I was expecting.
There's more. Yeah, so there's a big difference.
There's more.
Yeah. Another one was suicide by organophosphate ingestion. So like we talked about before, although vital signs don't quite fit, there's a chance, I guess, at the end of your life after an organic.
This is this theories over what happened.
That
still
she
the same
maybe
patient.
had taken something.
She had taken
herself.
pesticide.
Mm-hmm.
Yeah.
The crystals came up. They weren't really covered all that well. But there was a thought. Now, this isn't a medical thought, but she was abducted by aliens, and this is the after effect because there's crystals in her blood. But that could have been from really late stages of cancer. She could have had some crystalline deposits. She could have had really high cholesterol levels. Could have been anything.
Yeah, I don't know. So did this case it got famous enough that people were wondering whether she had gotten abducted by aliens? So it turned into a whole news story. It must have turned into a whole news story.
It was a huge news story. Yeah, it was
a big old story. Like, oh my gosh,
sorts of papers,
many people collapse at this hospital, and it was you said it was in California, right?
In California,
everybody cares what happens in California. If this happened in Wisconsin, they'd be like,
The last piece of it was that there were suggestions that it was a cover up to cover up illegal activity, and I thought initially like, maybe they mishandled the case. Somebody screwed up. So then they were like, we're going to cover up this malpractice type case. But it was suggested that because in this hospital about 2 months prior, there was a sewage leak and apparently it stunk. And the hospital was all cleared. Like the state came through, the county came through. They said everything's good. But there were some people that suggested that the hospital staff were manufacturing methamphetamines. And the gas or the smelly thing was a cover up for that. And that was actually from the family, I think. I think their thing was like, they probably didn't realize that she was as sick as she was, and if it wasn't for everyone passing out, this never would have made the news. It was, like sad case, lady with bad cancer, dies too young. But I think they were kind of in disbelief. I think the other thing too is that they couldn't have access to the body. So it was released 2 months after her death. So then the family paid for an autopsy. I didn't see the results of that autopsy, but they said that her heart was missing. She had feces like on, but like it sounds like it was kind of a messy. Most autopsies are. But it had to be performed in like hazmat suits, and it was different.
Poor lady.
Finally buried. 2 months after her death. So it was a sad case, but the official hospital record, I think, said it was a DMSO exposure.
Huh.
But I think everybody after the fact is thinking it's probably mass psychogenic illness because,
Well, so it's probably both.
It could be both. Yeah, like maybe one person felt kind of ill, maybe even just from the smell.
She died. So like something happened to her. Mm-hmm. And then there's weird actual physical exam findings with the oily skin and such. Although I suppose that maybe could just be the chemotherapy or something.
Yeah. Or udder balm or anything.
Yeah. And then other people actually got sick. So something happened for real. But then, the other people, like it wouldn't make sense. Also, it's not like, chemical agents aren't usually, luckily haven't, knock on wood, really been exposed to any, but they shouldn't be like haphazard, right? It should be like okay, the whole room goes down, right?
Right.
Right. It wouldn't be just.
And then the EMS crew should have been the first to fall if that was something related to that. So.
I liked your radar going up. You're like, this doesn't make any sense. If it doesn't make sense, it doesn't make sense.
Yeah. Yeah. Interesting. Oh man, it's unsolved. I want to know.
Unsolved mysteries.
I think that's what we got for tonight. We appreciate everyone listening. We'd love to hear from all you out there. If you'd like to check out our merchandise or provide feedback, we can be reached through our website, www.poorhistorianspod.com. There you can send us messages and find links to our social media sites. We do work to respond to all posts on our various social media accounts. If you want to participate in the show, use our site to send us a medical history or trivia question to test Mike's innate knowledge and try to win your own medical eponym. He's really bad at them, so you'll probably win. If you have time, which I know you do, please go and leave us a nice 5-star review on iTunes or on whichever platform you choose. If you don't feel like doing that, tell some people about the show. Grab their phone and make sure to subscribe them so they'll enjoy it as much as we do. And hopefully next week our show mom will be back, so things will be much smoother. But until next time, the Poor Historians are signing out. AMA.
Poor historian, poor historian.